This is Pet Life Radio. Let's talk pets.
Let's talk about pets, baby. Let's talk about ticks and fleas. All the fun things that we see. Smart tips and tricks guaranteed.
Welcome back to episode number 6. This is Let's Talk About Pets with your host, Kat.
And Nessie.
It's almost like every time you forget, like, that you're supposed to say your name. So you're like,
oh, it's mine.
Well, today we're going to talk about sciencey stuff. Monoclonal antibodies. That's a big word. Big word. I guess it's 2 words, but it's what we talked about antibodies last time. So you guys should know a little bit about that. So we're going to start with a review.
This review is for... Let me take a deep breath before I do this. Animal handing gloves, bite-proof, multi-purpose pet glove for trips to vet, grooming, puncture-proof training, anti-bite, scratch for cat, dog, snake, falcon, grabbing, reptile.
Okay.
On Amazon.
That sounds like a lot of...
They wanted to include all the possible reasons you might use these gloves.
I love the picture for the gloves because it's just like this guy with his, or person, I guess I don't know, with his hands down in a triangle.
It feels like a villain moment.
It feels a little culty.
Yeah. I can
buy out these gloves.
The problem with these gloves are, as Ayana said in his 1-star review, Ayana is a him, a verified purchase, lined with synthetic materials, do not use for fire or welding.
You bought these specifically for one of the 2 of them.
I bought the bite-proof gloves for fire or welding.
He was like, this will work.
In dark green. These gloves are lined with some kind of rubbery material and insulated with fleece. Do not use these to protect you from heat. The lining melts or catches on fire and you will have a very, very bad time.
Did he catch on fire?
Ivana, did you catch on fire?
I think this man caught on fire.
Do you think when he looked these gloves up, like, because you went on Amazon and you Googled, right? And were you like, fire protecting gloves, and then you were like, bite gloves, that's the same thing.
Those are the ones. It might have been the way the picture one is. It looks like it was
cult leader. Looks like he knows how to handle fire.
Cult leader gloves will sustain you from fire or protect you from fire. Yeah, he caught on fire.
He said that the insides melted. So, like, did the inside go off before the outside? Like, did he burn from the inside out?
I bet you he just panicked in the moment and he didn't think to just take the gloves off. And he was like, patting his hands.
Oh my God, I'm on fire. I'm on fire. It's the fire.
And I bet it made it far enough to melt the inside of the glove before he was like, I should probably just take these off.
Okay, so what I learned is that bite-proof gloves are not fireproof and you should not weld in them.
Yeah, you don't want an animal with a fire mouth, so don't battle a dragon with these gloves.
These are not approved for dragon.
Okay, cool for dragons.
Needed to know that because I was thinking.
You think you're going to battle a dragon?
Hey, I might go in for some dragon dragon medicines? You know? Dragon meds too.
Today we're going to talk about monoclonal antibodies. Antibodies are proteins that the body makes to attach to infective agents called antigens. We talked about this. You guys know this stuff. The binding causes the body to produce white blood cells that are made to fight off these infective agents. Biological therapy mimics the way that the body's normal immune system fights off infections. Monoclonal antibodies, they are pre-made antibodies that are given to an animal. Instead of expecting the animal to make these antibodies, we're going to give them to them. It has existed in human medicine for over 30 years, but it is relatively new to veterinary medicine. How do we make monoclonal antibodies? So they're made by immunizing mice with the antigen of interest, which is the virus or whatever it is we're concerned about. The cells of the mice begin to make antibodies to the antigen. And then the antibodies, which are antibodies like clone. So it's the same antibody cloned over and over again, which is why it's called monoclonal. Makes sense. They're isolated and they're infused into myeloma cells in vitro, so like in a test tube, so they can live and replicate indefinitely. A myeloma cell, they're abnormal plasma cells, which is a form of white blood cell, and they replicate rapidly and out of control. So it's perfect for replicating antibodies, which is why they use it.
Sounds scary.
Yeah, but like antibodies are good.
But like the good kind of out of control, like that one friend that you take out because you know she'll like make the night more exciting. But also you're like, it's time to go home now, girl.
She gets up on the bar and you're just like, it's funny, but also we're gonna get kicked out.
Also, you just spilled all that drink.
Yeah, maybe get some more.
Yeah, I get it. I like that friend.
And then the monoclonal antibodies made by the myeloma cell are isolated. Then recombinant DNA technology is used to caninize or felinize and make it to where basically that species doesn't reject the mouse protein, because that's where it originated, was in the mice. So what is recombinant DNA technology?
RNA. No, I'm just kidding. Yeah.
Mitochondria is the powerhouse of the cell. That's all I got from biology. That's all I wrote. But the mitochondria has nothing to do with this.
Gotcha.
So recombinant DNA technology is a laboratory technique that combines DNA from different sources to create new genetic sequences with the desired traits. So they just take it and they make it to where the dog or the cat will accept it for what it is. Because it originally came from the mouse. And if you put like mouse protein in a dog, then the body's going to be like, oh. So they have to make it to where a dog or a cat will be able to like accept it and use it. Once injected into the species that it's made for, the antibodies target the antigen and eliminate it. And monoclonal antibodies don't have intracellular activity, so they're generally well tolerated by patients. Basically, they do a bunch of really cool stuff and they make it to where the body's immune system can like use it efficiently. That's the dumbed down version of it. It's pretty cool. Palate cleanser?
Yes, my palate does not feel. My palate feels ready. I don't know where I'm going with that. I'm just gonna.
Your soft palate or your hard palate?
Do I have both?
Yeah.
Interesting. Which one is the hard one?
The one that's hard. So if you take your tongue and you run it up against the top of your mouth, when you get to the squishy part, back there, that's your soft palate.
Yeah, where's the hard one?
I believe it's the hard part.
From my mouth.
I only know what the soft palate is because I used to like be in choir, and they're like, you need to raise your soft palate because it helps you sing.
Gross. I hate that. I'm not raising my soft palate anywhere. In fact, don't worry about what I'm doing in my mouth.
We can hear it though. I'm serious. You can hear it. Like if someone's singing and they don't use their soft palate or whatever, you can hear it.
If you're going to raise it.
I could go into a whole thing, but that's not what we're talking about.
No. This is for the same pair of Colt non-bite, the Colt gloves with the bite proof.
The dragon gloves.
The dragon gloves. This is also a 1-star review from Sushi. Sushi is a verified purchase, and it is called Not Bite Proof.
That sucks, considering their bite proof.
I feel bad for how they find out. Okay. So, these gloves are okay for scratches, but they are absolutely not bite-proof as advertised. A cat bit right through them and pierced into my finger. I would be in the ER right now if it hadn't had its shots. Do not buy these for unvaccinated animals or anything that has a chance of having rabies because they will not protect you from getting bit. They should not advertise as bite-proof because it could get someone killed.
First of all, I have concerns.
Was it your cat?
She said not to use on anything that could have rabies. Are you strapping up these gloves and going out there to like mess with a rabid raccoon or something?
Don't mess with the rabid raccoon.
If something has rabies, you shouldn't be strapping on the gloves and going out there trying to pick it up.
It's a bad idea. But like, do not use these gloves if you're handling animals with rabies. Also, it does work against scratches, so I mean, there's that.
Yeah, I mean, you're not going to get cat scratch fever, but also you're going to get rabies.
These are not the greatest gloves. You can't handle fire in them. You can't weld things. And apparently you can't even handle things that will bite you with bite-proof gloves on. Like, I'm not understanding the point of these gloves. Is it just to lure people into your cold?
That's when it's not for dragons. We decided not for dragons.
I'm on the lookout if anyone knows a good pair of dragon gloves.
We need dragon gloves. I feel like you're going to need a whole lot more for a dragon.
Like the suit of armor thing?
Yeah.
Metal.
The chainmail? Yeah. That was a lot.
That review for bite-proof gloves is not bite-proof.
Well, she said that she got bit, and she's like, if it hadn't had shots, I shouldn't go to the hospital. If you get bit by a cat in general, you should probably go and get it checked out. Cat mites are gross.
Yeah, if they break skin, you're totes gonna get an infection.
Yeah.
That bacteria is in there.
They're nasty. They're real nasty.
I have another one for the same gloves if you're interested.
I'm so interested.
They had a lot to say about these.
I'm so interested in the dragon gloves.
This one is from Mashallah.
Mashallah sounds salad.
It is a 1-star verified purchase, and it's called Finger Sewn Shut.
Okay. Please. I'm so invested.
This is for the same pair of Colt gloves that are non-bite proof and non-fireproof by Mashallah. And it's a 1-star verified purchase called Finger Sewn Shut.
Okay.
Yeah.
I'm so ready.
Feels like a problem already. So, nice glove if you're missing a finger, as it is sewn shut. But unfortunately, I have all 10 digits, so I can only wear one glove with the other hand exposed. Maybe I will lose a finger someday and can get full use out of these.
So it was sewn shut, she couldn't stick it. Why didn't she just break it?
Because it's not supposed to appear.
She's like, I'm just not going to wear that glove.
Until I lose this finger, and then I can wear these gloves.
Girl, don't go out losing no fingers. Just wear the gloves. Yeah.
Not only on the one hand. So you're protected from scratches on your one hand. And then not on the other because you have all your fingers on that hand.
What are these people using these gloves for? That's what I want to know. I want to know their, like, normal people, their reasoning for buying the bite-proof gloves.
Well, that one guy said for welding.
I know.
And the other guy said to handle things with rabies, so I'm not really sure.
Is it for their own pets? And they're like, I just want backstories.
That is a good question.
Yeah.
He loves it. He's like, I'm going to hang on to this other glove in case I ever lose a finger.
And put that up in the attic.
Then that day, and you have to lose the right finger out of the 5, right? Like, it has to be, because if it's like, well, that was my thumb and that's not the one sewn shut, so I guess I still got to wait on these. Like,
sometimes they be taking your toe and putting it on your thumb if you lose your thumb.
The monoclonal thumb body.
If someone was like, you're gonna lose a finger if you don't tell me something. Wait, I got a glove at home. I need it to be my pinky. Can we trade fingers? Can we trade hands?
It's like, pick.
Right, can I pick? Yeah.
That makes sense.
Okay, well, good luck.
And then she gets home and she's like, baby, go to the attic and get my glove. I can wear it now.
She was like happy to lose this year.
Weird. I mean, I guess.
Yeah. All right, so now we're gonna take a little commercial break. We're on Pet Life Radio now, so stay tuned. We'll be right back.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There is no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms. And our live radio stream goes out to over 250 million subscribers on iHeartRadio, Odyssey, TuneIn, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
All right, so that was our commercial break. Welcome back. All right, so back to reality. Monoclonal antibodies, there are only a couple in veterinary medicine because it's new. But the most popular one by far is probably Cytopoint.
How many of you guys are familiar with the Cytopoint?
Yeah, some of them need it every single month for their whole lives. They be itchy like that. Cytopoint is for dogs with atopic dermatitis or pruritus. Pruritus is just a fancy word for itchy.
It is a fancy word. Is it French?
It's French, yeah. Atopic dermatitis is a genetic condition that is accompanied by dry skin, flaky skin, and it often presents with secondary infections because it's itchy and they're scratching it. It is normally immune-mediated due to environmental factors. So Cytopoint can definitely help with that.
And those environmental factors are crazy here in Florida, too. Like, they just be coming for you.
Come.
Like, oh, you want to go pee on the grass? Here's some atopic dermatitis.
Let's just sprinkle that into your...
Here you go with some more sprinkles. Like, what are we even doing here?
We're sprinkling pruritus everywhere. That's what we're doing. So patients with pruritus or atopic dermatitis, they have a cytokine developed in them called IL-31, interleukin 31. This is where it gets fancy again. Well, a cytokine, it's a cell that's a part of the immune system. They're communicator cells, so they attract immune cells to a particular site. So like site of infection or trauma, and it causes the body to react. Cytopoint contains antibodies, so monoclonal antibodies that bind to this cytokine, and they prevent itching from atopic dermatitis and pruritus. So it blocks the itch factor, essentially, by using antibodies. So that's pretty cool.
Though you can break the cycle, it does not permanently stop the itch cycle.
Yes.
So if your pet is itching due to fleas, you need to control the fleas first. If your pet is itching because they have a skin infection on top of an allergy, you need to treat the skin allergy along with the Cytopoint. It's not a one and done type situation. You have to treat the other factors as well.
True. So if you're covered in fleas, we might need to nip that in the bud.
There has been a time or two that I've brought a dog to the treatment area that's there for a Cytopoint because they're itching, and I see the fleas and I'm like, well, this might be one.
Yeah. So it lasts 4 to 8 weeks.
I want to say it depends on the pet. I hear that
It does depend on the pet.
sometimes they get it up to 8 weeks of relief.
So 4 to 8 weeks. And sometimes people will like bring their pet in for one Cytopoint and then they're good for like a little while. Like
Seasonally.
Yeah.
Only in the summer they
But
have the allergy.
it is marketed for 4 to 8 weeks. And that is just when like the body works through it and they'll need another injection. It's a subcutaneous injection. So it's very quick and easy. It's kind of just a swing by, let us do it real quick. All right, go on your way. But, you know, like she said, if they have secondary infections or if there's fleas, like you have to figure that out, or else the Cytopoint, like it's not like gonna help.
The efficacy will not be potent.
Yes. So we use Cytopoint a lot at our clinic, and they're relatively safe, like I said, because they don't have intracellular activity. So it's better than like putting them on medications.
Like steroids long term, NSAIDs, and those kind of things.
Yeah. Now review.
Cat grooming bag for nail trimming, pet grooming, hammock for vet visits, adjustable anti-bite, anti-scratch, cats/dogs, restraint bag for injection, medicine taking, back length 15 to 20 inches. Are you confused at what this product is?
No.
Okay. Yes. So it is a cat bag. I have a 1-star review from M, a verified purchase.
I love a good cat bag, but go on.
Cannot get my cat in this thing. What a waste of money. I think I'm too late to refund. FML. That's the title.
Okay.
That's not even, we haven't even hit the review yet, which I feel like I know what the review is about off just this title, you know? She got in size small. There is no way to get an anxious cat in a bag shaped this way. There's scratches all over me, and now I missed the vet appointment, and this literally cost me my living situation since I can't get my cat vaccinated to meet regulations.
Oh my gosh. She was betting on this bag.
Everything on this bag, yeah. And her cat wouldn't get it, and it scratched her up, which wouldn't have happened if she wore her flame-proof were scratch repellent, according to other users. So
that's so sad, actually. She was like, you gotta get in this bag. And then it didn't get, and then, does she not have a kennel? I'm confused. She needed the bag to get it to the vet?
I don't know her reasoning. Like, so cat bags are not, in my opinion, meant for cat transport.
No.
I think that's what, like, carriers and things like that are for. So maybe that's where she messed up first.
Maybe it wouldn't get into a carrier, and this was her last hope.
If I put it in this cat bag and then put it in a carrier, then I could get it to the vet, maybe. I don't know.
I'm sorry. If it was going to cost me my living situation,
You're getting in this bag.
you getting in this bag, girl. Or maybe, like, I don't know. That's a hard one. That's a real pillowcase. I've had people bring their pets or their cats specifically, like, in weird things. Laundry baskets, pillowcases.
And we had that man who brought him in his Under Armour gym bag with the bag unzipped, so the cat's head was just out, and he was like sitting in the lobby just chilling.
That's crazy.
I bet his head was out because it stunk in that bag.
It was probably smelling like gym socks.
I hate dirty gym socks.
Ugh. In your eyes and your nose and your mouth, you tasting it. I'd stick my hand out too.
That dirty gym socks did remind me of a conversation that I got to be part of in a room with the doctor and the client the other day, where they both were talking about how their cats really love to get in their shoes after like either a workout or like a long day at work. And I know my face looked a lot like that while they were talking, and they kept being like, I know my cat's so weird, but the two of them were relating so hard about their cats loving their stinky shoes.
I don't know though. My mom's cat loves feet.
Mm-hmm.
Like he'll rub on your feet, on your shoes. Like,
does he put his head in the shoe?
Mm-hmm.
Yeah.
Yeah.
Apparently, I didn't know this was a thing, but I learned that day. Then they're like, the cat will lay next to the shoe or just put its head in it. And
my most favorite thing ever is when cats smell something and then they have this face where they're like,
I know, like half little open mouth thing. Yes. If I have a cut, my cat will sniff the cut and make that face, because I guess it doesn't like the way my blood smells.
I had my cat sniff my foot one time and make that face, and I was a little offended.
Like, excuse me, if you smell your feet, you dig in your cat litter.
Yeah, I mean, don't judge me.
So honestly, if your feet don't smell like roses, you can judge mine. This one is for on our topic of injections. Okay, it is the Cool Shot pre-injection numbing device for diabetic pets. Prevents pain when injecting with veterinary insulin syringes for cats and dogs using U40 pet insulin syringes, pet test diabetic supplies. There's no pet testing.
So they're diabetic needles.
No, it is a numbing
device.
An injection numbing, pre-injection numbing device. This person is called the Lost Boys. Let's go with the Lost Boys. It's a 3-star, so it means it's not terrible, right? Because it did get 3 stars. It's verified purchase. And it's called Limited Instructions, may or may not have a cap on it. Lost Boy said, while it seemed to help, although I received one without a cap and the instructions say to remove the cap, so I tried to actually remove the part of the device that you are supposed to lay on the spot of your pet that you intend to inject the insulin or whatever. That was all one sentence, and I almost didn't have enough breath to finish it. Next sentence. This is also going to all be one last long sentence. So this whole review is 2 sentences. So another customer advised me that it should have a blue rubbery cap. Mine did not. Just saying, would have given it 4 stars if I received a complete device with better instructions that identified the parts the device included and had a cap.
So it's a numbing cream for injections? I'm rolling.
Nope. So it's this like rubber tip weird thing that you put in the freezer, and then you hold this cold tip to the area you plan on putting like your insulin in the dog, and it just freezes the skin till it's numb.
Okay.
And then you put the shot in the spot you just froze with this.
I almost feel like when things are cold, it hurts more for me. Like, have you ever had cold feet and then hit your toe on the corner or something? It'd be hurting real bad. I don't know if it's just because it'd be hurting real bad or if it's because, like, I feel like when it's cold, it hurts a little bit more.
Right. I don't know about anyone else's animals, but I can tell you, as me or my animals go, if something frozen cold touches me, I like move away from it because it's uncomfortable and I don't like it. And you have to, pin your animal down and freeze a spot of it so you could give it a little baby injection.
Yeah, I feel like just going ahead and getting the injection over would just be easier.
And this guy had no idea, and he broke it because it said it should have a cap on it and it didn't. Also, what happened to the cap?
Maybe she was sent it back.
No cap, y'all.
No cap.
Ain't no capping on this podcast.
No cap. Yo. No cap. We sound so...
We're talking about throwing bars last podcast.
I know what Riz it is. YOLO.
Yeah, I still say YOLO.
No cap, I guess, is one. Anyway, the next one that we're going to talk about is Solensia. So Solensia is a monoclonal antibody. It controls feline osteoarthritis pain. The way that it works is it targets nerve growth factor and binds to it, and it prevents it from attaching to nerve cell receptors and causing pain. So nerve growth factor, it's a neuropeptide which transmits pain signals. So essentially, we're blocking the pain before it causes pain. NSAIDs, so non-steroidal anti-inflammatories, like meloxicam and stuff like that, it can cause kidney damage. So they're not really suitable for long-term use, which is where the monoclonal antibody comes into play, like Solensia. Is about once a month injection. And also you don't have to pill your cat because it's very hard to pill a cat.
Especially 9 deworming pills.
Yeah, 9 deworming pills.
We tried that before. It didn't work out.
$128 a month or a week or something.
Yeah. Very expensive.
Yeah. So this might be a better solution to having to give oral pills to a cat every single day. And it's probably better for their kidneys. There's also one for dogs called Librela. It works the same way that Solensia does, and it blocks that nerve growth factor, so it targets pain. So for osteoarthritis in dogs, if your dog has osteoarthritic pain and you hate giving your dog pills, it's not well tolerated, talk to your vet and see if Librela or for your cat, Solensia is a good option going forward in the future, because it might be something that helps. So sometimes it can take till the second injection, though, to really become something that's going to start working. So if it doesn't work after the first injection, give it to at least the second injection and just see if it's something that works for your pet. Because like most things, not everything is going to work for every single animal. So it might be something, but we've had a lot of people that say that it really helps improve the quality of life. Like their dogs are running around acting like puppies again. So it's worth a shot. Worth a shot.
Cats are getting into the mischiefs, doing the counter jumping.
Let's do a review.
I have a review for dispensing needle with cap, sterile, disposable injection, lure lock, lure slip syringe. Individually sealed for lab, refilling liquid livestock pet. 18 gauge, 1 inch. And that is just the 20 at the end. So I guess that means there's 20 in there. Okay.
Long, big needle.
Long, big needle. And this is a 4-star review from Duke. Verified purchase. And it's called Works.
Works.
Duke said, not a sexy purchase. No leaks or problems.
Did you mean that?
I don't know if he's typically purchasing sexy things.
You said they were needles.
Yeah, they were 18 gauge, 1-inch needles. 20 of them.
Did you try putting some heels on it?
Whoa! I lipstick, a needle heel, little
A mascara,
I've never
eyelashes.
looked at a needle and been like, you know what you need in your life? A little spice.
A little bit
Need to jazz it up a little.
Okay.
So it wasn't a sexy purchase for him, but like it didn't leak. So
For I don't want to know. I don't want to know.
what did you use it for, dude?
It took us that long to like connect the dots to that. Okay. One more.
Okay. They are for a 3 ml syringe, a 50-pack disposable 3 ml syringes, and it's a 3-star review by Duncan. I think we called Duncan out before. We're gonna say it's Duncan again, and it's called Sharpie. My doggy, it's spelled weird, so I tried to say it weird. My doggy hasn't cried so much. Must be sharp. I'd try them on myself, but I'm a coward.
Oh my god. For syringes?
Yeah.
Do they come with needles?
Oh, 23 gauge. So he's using them on his dog, and the dog is not crying when he uses them, so he thinks that means that they're sharp, but he's not going to test them on himself because I'm scared.
Why would he even leave a review like that? I'm too scared to poke myself.
But I poked my dog in his eye.
Well, 23 gauge needle is real small, so not sexy.
No, and not sexy yet.
Painful.
What's the sexiest gauge needle we have? The 20.
20 gauge all the way.
It's hot.
I just love me a 20 gauge needle. Like, I love it for drawing blood, giving injections, like
I like it because it's
anything. I worked at a place that had 18 gauges that were pink. So be careful because sometimes the colors change. Yeah.
Y'all stop doing that.
Or like the 22 gauges, instead of being blue, they'd be gray.
I don't know whose idea it was, but keep it one color. You know?
And
Nobody asked for all that. Keep your needles sexy, first of all.
them sexy, put fake lashes on them.
Keep them sexy, but also make sure they're sharp by checking them on yourself first.
Oh,
That's terrible advice. Don't listen to me.
I would not recommend stabbing yourself with a needle. I mean, you can assume if you've ever had an injection, you know what it would feel like.
But he's not sure if they're sharp enough, but he's also scared to try. And I think it's a pretty good indicator for dogs not crying that it must be sharp.
Maybe you're just good at giving injections.
Hey, you're good at this. Good job.
Good job. Good job, buddy. Here. So now we're going to talk about the last monoclonal antibody in veterinary medicine, and it is actually for parvovirus. Wow. So it is called canine parvovirus monoclonal antibody.
What a creative name.
Yeah. I don't think it's been like taken on by anyone yet because it's one of the newer ones. So it doesn't have a name yet, like Cytopoint and Silencia. It's just CPMA.
Cash me outside with your CPMA.
How about that?
How about that?
No cap.
No, okay.
So the canine parvovirus monoclonal antibody, it helps decrease the supportive care needed for parvovirus. So parvo obviously is a virus. And because it's a virus, there's really no like cure for it. You just have to let it run its course through and like let the body's immune system fight it off and deal with the symptoms of it essentially. So like the diarrhea and the vomiting and things like that. But the parvo monoclonal antibody, it binds to the surface of the virus cells and it prevents it from causing further issues by entering into the cells of the intestinal lining. So it can seriously decrease the amount of supportive care needed and help patients get better quicker. It's an intravenous injection given by your veterinary staff, But just because you have the parvovirus monoclonal antibody given to your pet doesn't mean that they don't still need hospitalized supportive care.
So this isn't like when you get the distemper parvo vaccine. This isn't like a preventative measure. This is like a once you find out the dog has parvo.
Yes. Yeah. Parvo affects about 330,000 dogs in the U.S. annually. And without treatment, 91% of puppies with parvo die. So the CPMA, it is the first therapy to treat parvovirus that targets the virus itself instead of treating the resulting clinical signs.
Oh, wait, I just figured it out. CPMA, how about that? Instead of like, remember how earlier I tried to do it with the Catch Me Outside part, but you could cut that out because it already starts with a C.
CPMA, how about that?
I like it. Let's patent that. Hey, when you guys start to push your product in veterinary hospitals and whatnot, try that.
That can be the name of our episode.
Yes, we got it.
We always figure it out. Oh,
Yeah, perfect. Oh, damn, I feel so much you don't even know.
okay. All right. I'm glad. So in a clinical study of the CPMA efficacy, there were 21 dogs who received a dose of the monoclonal antibody. And out of the 21 dogs, none of them died. And their symptoms were less severe and resolved more quickly than the control group of dogs. The very first dog to ever be treated with the monoclonal antibody was named Cookie. Cookie was an 8-week-old, or is. I just ruined the end of the story. Cookie
Cookie.
An 8-week-old pit bull mix in California who was 4.5 pounds, not been vaccinated, and did test positive for parvovirus. Within 48 hours of receiving the monoclonal antibody, Cookie was eating, doing well, acting like a puppy, did well, and went home and was happy and good. Yeah. Cookie.
Good job, Cookie.
Yay, Cookie.
4 pounds and just the whole world on your shoulders.
So, like I said, the monoclonal antibody is given in addition to supportive care with like IV fluids, anti-nausea medication, things like that. But it is a very good thing for patients with parvo. So, science!
I love science. It's like so good for you.
Science is very good for you. To wrap up monoclonal antibodies, they are great. And they use antibodies to help you, and then you feel better. That's the end.
Antibodies equal feel better.
Antibodies feel better. That's all I have.
Online vet 24/7 Vetster. It's a online veterinary app.
All right. I
And
have my doubts, but continue.
well, Zachariason also had his doubts because he gave it 1 star. $66 for 10 minutes. 5 minutes was her trying to get rid of an echo. Then all I got was take her to the vet. I could not see what she was seeing. App has no phone number. Live chat unavailable. It says 24/7. Won't let me email him. I just got robbed. This lady might have actually just robbed you of your $66. She wasn't even a vet.
I mean, honestly, like if you can't put your hands on a patient to look at them, listen to them, do everything that you have to do in a physical exam, how are you going to say that you have a client-patient-vet relationship when you can't touch the pet?
I think televet medicine, though it's a direction a lot of human and animal medicine is going in, and we'll have to eventually get used to it, I don't think it's there quite yet. And I think if I paid $66 and it was like her going, is there still an echo? Can you hear an echo? And then she goes, oh yeah, you should definitely take your pet to the vet. And then you just lose connection. And then you're like,
I'd be pretty mad too, honestly. But what did you expect? I mean, maybe for like a skin infection or something, right? You just zoom in on it.
Skin infection to you? It does. Let me get you some medications. But if you're like, hey, is my dog's eye coming out? And they're like, it is.
Go to the vet.
You should go to the vet. Also, $66. And is the echo gone yet?
Can you hear me now? Can you hear me? Can you hear me now?
Yep.
Good. Yeah, I would be mad too.
Do you think those veterinarians are working from home?
Oh yeah, they're sitting in their office.
They just from the waist down, bottomless.
They only see top up.
Right.
So like,
They're
just
just
underwear.
yeah,
Yeah,
walking around in their drawers.
absolutely.
Okay.
I feel like that's what most telemedicine people do.
Letting the drawers hang out.
All right, one more.
I have another 1-star review for the same app, and this one is Roberto. And he said, I got their premium service for $137, which includes 4 visits per year. The vet told me I should bring my dog to the vet. I asked customer service if I could cancel my premium service and just pay for the visit, the $66, since I didn't find it helpful. That's more than fair. The customer service was difficult to deal with. I don't recommend them.
So you're gonna call them and they're just gonna be like, take them to the vet.
That's 2 in a row. That's like, I reached out, they charged me, and they were like, take him to the vet. He's got 4 visits for the year, right? Do you think it's the same answer for all 4 visits?
Why would he go ahead and pay for the premium before having the first appointment?
Before having this, maybe they make you. They're like, hey, before we get a vet on here with you, would you like to pay $66 for today? Or would you like 4 appointments for $137, not including all the taxes and things we're going to take from you?
Well, they can't do anything other than,
I think they can prescribe medication. However, I did see other reviews on here that said the medication that was prescribed never arrived.
wow. I wonder if you can get it sent to a pharmacy. I wonder if they, I don't know.
Send a script
Yeah,
and I'll go fill it myself.
I'll take it to the Walgreens.
Take it to the window in the Walgreens. I don't know
Walgreens.
why I did that.
Yeah, I can't sing.
This episode has been wild.
This one's been way wild.
If it feels like a fever dream, it probably was.
Yeah,
You know.
we struggled, but it's okay. We hope you learned a thing about monoclonal antibodies.
And if you've been hesitant to go and get that Cytopoint or that Librela or that Silencia, like, go and do it. Like, just try it.
Do
You know,
As long as your vet recommends it.
Yes.
Yeah, as long as your vet wants to do it and recommends it, always listen to your veterinarian. But we have seen pretty good results with it, and we highly recommend it. So ask your veterinarian about it. See if it's something that your pet would benefit from.
We also have a AI song for you. Once again, the antibody swing.
Antibodies. We have things that you can go check out. We are on Pet Life Radio. So you can go to petliferadio.com and check us out under their podcasts. You can also find us on facebook.com at Let's Talk About Pets. And we also have an email, and it's talkpetswithus@gmail.com. You know, if you find something interesting, let us know.
Something that you find funny, send it on our way.
Send it
Let me
towards
use it. I'll put your credit out there.
You creds. Mad creds.
Mad cred. I'm all about it.
All right. Well, thanks for joining us. We will see you guys later.
Bye. Bye.
In the lab of bright and sterile where the scientists reside, they brewed up special potions that fit like choir ride. Monoclonal miracles, they work with great finesse. From itching pups to aching cats, they surely do impress. Cytopoint, my itchy pal, you're scratching all day long. But now this magic potion makes you sing a different song. A little poke and suddenly your fur is soft, so cheery. Gone are all those sleepless nights, now you're just plain weary. Oh, that concocted sorcery, you're healing all the pets. From puppies round the fountains to the kittens in your nets. Librella's and Silencius, your power's truly grand. Keeping tails a-wagging with your gentle healing hand. For pups with humble arthritis, there's Librela in the mix. A potion full of wonders, it's a clever bag of tricks. Nuancing their movements, making life a gentle waltz. No more creaky joints for them, a spring is in their vaults. And for the feline comrades who slink and slumber low, Solential works its magic, sets their paws to glow and show. Those days of silent suffering now cast out with the tide. A playful purr or stretch of paw, in you they now confide. Oh, lab concocted sorcery, or healing all the pets. From puppies round the fountains to the kittens in your nets. Like Rebas and Solencius, your power's truly grand. Keeping tails a-wagging with your gentle healing hand.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.